All right, hello. This is week 7 video discussion on critical thinking. We're going to go ahead and talk about a scenario that Professor Steele has given us. So I'm just going to read this scenario and then we'll go about. So the situation is you are a student, a technologist takes you into a surgery case and you both set up a C-arm. Shortly after the case starts, the surgery tech is paged. They have to go into another case. They ask you to stay in the room and push the button for floor if the surgeon asks, and then they turn and walk out of the room. What do you do? So following our critical thinking steps, we are going to identify the problem, investigate the problem, formulate viable solutions to the problem, and select the best solution. So for starters, identifying the problem, we kind of want to talk about what is wrong, what problem is there, does a problem exist, is there even a problem, what caused it, and who's kind of responsible for fixing it. So Felipe, do you mind going over identifying with that?
Yeah, so as far as identifying the problem, in this case, we are students and we are left alone. Would I say, is there a problem? I think we're told in the program very explicitly that we can't be we're not licensed technologists, so we can't be left alone with the C-arm. We can't be using the C-arm on our own. I think it's one thing like indirect uh when we are being indirectly supervised, performing like a basic chest x-ray, the tech is there, but this time the tech is not in the room. It's C-arm, and they left to do something else, so they're not there available for us indirectly to reach out for any assistance. One of the doctors, the providers there can potentially be licensed to use the Flora equipment, but we don't know. So for us, immediately identifying the problem, we would, yeah, that is the problem, that our tech has left the room. We have no licensed technologist supervising us, and we are not permitted to use the C-arm on our own.
Yeah, I agree. For the problem, I put the tech left. That's a problem. We're unsupervised and just being left alone. One of the techs actually told us one time that like by law, we're not allowed to actually like push the button. Like by law, like it was a thing. Because one of the students got from a patient, the patient didn't want the student helping with the exam at all because they were a student. And so she didn't do anything. And then the tech was like, well, by law, they can do everything but push the button. So I thought that was very interesting. But yeah, does anybody else have any comments to identifying the problem? Anything?
I think that, like Felipe said, the tech shouldn't leave the room as we are students. And then I feel like they should know that we cannot be left alone, because that's one of the things that they tell us in the first place. You have to be, it has to be direct supervision or indirect, but the technician should be immediately available. So if he's leaving, then he's not immediately available.
Yeah, I agree. Anything, Danae?
Yeah, I agree that the same that I think it's pretty well known, and it's something that's established like on day one, certain situations that we aren't able to be left alone on. So yeah.
Kaylon, anything about the problem?
I agree. I think you guys covered pretty much all aspects of that there is definitely a problem if we're left unsupervised during fluoro in this ER.
Awesome. Okay, so we're gonna move on to step 2, which is investigate the problem. I'm gonna go to Danae for that one.
Yeah, so one of the questions that's that we can ask when we're investigating, a big one that stuck out to me was if there's a safety risk and liability implications. And I think in this scenario, that yes, there would be liabilities and safety for the patient. I think that that's definitely part of the problem. And another one is what is known about the problem. I think we kind of covered in the first one too, where we said we're not supposed to be alone. So, and like you said, by law, we can't press a button. So I think that's pretty much some of the factors there.
Yeah, I agree. I think the patient, I would feel bad for the patient feeling like
Right.
uncomfortable. Like,
Mhm. And
especially,
especially like if the patient found out afterwards, like the student was, I would be like, oh my gosh.
yeah, like you never know if it's happening to me, you know what I mean?
Yeah.
Like, Felipe, you got anything on
Yeah, I think
investigating the problem?
kind of built on Danae's comment, like, yeah, I'd be like freaking out. I was like, oh, a student did it. I was like, well, everything went well. Like, you know, it sounds like you've got a very skilled student, so great. But you'd still be kind of a little on the edge, like, doctors are there, but you're letting a student do this part. So it does kind of, you know, the biggest thing that we know in this field is building trust, not just like in
Mhm.
exams, but just like even the way you present yourself, you talk to the patients, you know, even a simple chest x-ray. I was like, hey, we're gonna do this because of this, and then you need to repeat something. You're like, we're gonna do this other view again. And so building that trust, building that, you know, problem as competent as we can be, you know, kind of like we can be very competent, but we're still not allowed to be, you know, left alone. So one thing that kind of stood out for me, what are the technical considerations? So I don't know if it's more related to technique or anything, but you know, like, you know, if you look at that aspect, we could be ill experienced, and if the providers, like the doctors, while we're in the operating room, they're saying, hey, we need to move this certain direction, we need to do, you know, where experience kicks into place, we're not going to be there. We're not going to know if it's a thicker body part, if it's a thinner body part, if we need to up our technique, if it's so anything specific like that. So that could, you know, lead us down a rabbit hole where, you know, that could be a bigger problem for us as students. You know, we don't have that experience. So I think that one's a big one that kind of stood out for me.
Yeah, my other insight would be is, do you guys think that with maybe proper instruction, or like would you or like maybe the fluoro exam isn't invasive or anything, you know what I mean? Like it's just maybe a simple one. Like would you guys feel comfortable, you know, it is just pressing a button if that's all it is. I don't know if you guys would be comfortable just giving like detailed instruction and completing it on your own if you had to, or like you were put in that situation. You know what I mean?
I don't think we're able to as students, are we, for the OR? Like we can't be alone at all, right? That's what I thought.
Yeah, I agree with you. I think we're not. But maybe like this case, like just as far as investigating the problem, like did the tech completely leave to another part of the department and they get called onto some other case? Or did they maybe just go outside to review something really fast and they're, you know, it's indirect supervision, so they're immediately available outside the room. It's like, oh, you need to come in and like the student needs help with this. And so, but like I kind of like what you were saying, Jessica. I was like, maybe we're giving specific instructions, we're giving overview, it's a simple exam, like student can do this. I will be the licensed tech right outside the room. I just need to do this really fast, but I am not going to another part of the department. So I guess investigating and understanding, like kind of like what Kaylin was saying, like we may or may not be able to do this on our own, but you know, there's mixing your ideas. So that's interesting. I like that.
Mhm. For some questions, I maybe was thinking about like investigating, like what's the next step? Like what will I need to do first? You know, like where are we in the surgery or the procedure? Like how life or death is the situation as well. It didn't really give us that in this scenario. Like So like, what's the first step that we need to do? And like, who do I talk to first? Do I talk to other staff? Do I talk directly to the surgeon? That was like kind of what I was thinking for investigating, but
Got it, got it. Yeah, that's good, because we also have to utilize like other healthcare professionals, like, you know, how you go into, I don't know, emergency room or whatever, and there's like nurses and they're doctors, and you know, sometimes maybe they can help you out with their experience. They've dealt with x-ray techs before, so they might have an idea of what you need to do, you know, and vice versa.
yeah, if there's like other hospital staff that knows. Has this happened before?
Yeah. It probably has.
I was
Anything, Viviana?
I was thinking more like, what about we said, no, you can't leave, you know, like you can't
Mhm.
leave me alone. Like, how could that like affect everyone in there, you know? Like, okay, he says like, oh, I'm gonna step out. I was like, no, you can't leave me alone. I was like, how would that like be around there, you know?
Yeah, totally, totally. Okay, well, let's move on to the possible solutions. Let's see. For me, the possible solutions I put would maybe like, if pause, I know it's a surgery, but I put pause the like exam if possible, like, pause it maybe.
I put
It was
that
like a
too.
quick fix. I was like Kayla was saying about like how life or death is it? Is it like, you know, can they wait? Can they make a call real quick? And maybe like they could call a tech over to supervise me, or somebody else can take care of whatever they're doing. I don't even know how you take a call during a surgery, but they got paged over or something. So yeah. Any other ideas, Danae?
That was exactly what I had as far as a solution. Maybe like just waiting, I probably wouldn't press the button. And see, yeah, like how you said, if somebody else can come or take care of that other scenario. I feel like other staff, like the surgeon or whatever too, would probably maybe feel the same way. Like I don't think they would want to pause their surgery for, you know, like I feel like it might be, I feel like everyone can kind of get on board as far as like finding another person or finding the solution with you.
Yeah, yeah, I agree. There was I think a question was like, who's responsible for the solution? Felipe, you want to go into that?
I was literally just reading that, but I was also reading another one. So as far as formulating a solution, who's responsible? We're students. Um, uh, like I was saying earlier, is one of the, I know I've heard some of the other providers, I mean, some of the techs say, oh yeah, so this other doctor also has their own fluoro license, so they can do it themselves. So maybe there's another doctor in the room that does have a fluoro license in which they're able to supervise you. But who's responsible with finding that solution? I like what you guys said earlier. Maybe the tech got called out and they send someone else because you know, prioritizing those, you know, stat calls versus like a surgery. Maybe they're not able to put it on pause. I hope they do and they can, because like you were guys saying, like we're gonna be left alone in here. But maybe this specific tech has, you know, some sort of skill that they need. That's why they're taking them away and they're sending someone else. But you know, I think we're, as students, we're very, very low on the totem pole. So I don't think it is our responsibility to find the solution, but it is our responsibility to make sure we uphold those like professional standards. So we can't be left alone. We can't really be pushing the button. I know it's something as simple as pushing the button. And like you guys were saying earlier, where are we in that surgery? Are we at the beginning where we're probably doing like a scout or something, or are we at the end where like, oh, okay, everything's done, you just have to, you know, do that final shot, let's, you know, make sure how everything went, and similar to that scout, you know, just take a last radiograph and be like, okay, that everything looked good. Like, so understanding, you know, where we sit and whether it's a something simple, and finding that solution is, you know, oh, okay, this is not that bad. I have doctors are here. I'm not gonna, you know, totally make the surgery go south. And that was what I was thinking. I was also looking at how will these professional standards be applied and modified to fit unique situations presented by this problem. You never know. Are we at the end or are we at the beginning? You know? So that's kind of what I was thinking.
Yeah. Caitlin, you have anything?
For this one, I kind of wrote down what you guys already covered, like if the surgery can be paused, if another tech could be paged and we don't need to click the button within that time. Or maybe if like a creative, I know one of the questions is there a creative solution for this unique problem? Maybe there's another person who's able or authorized to complete the exam, kind of what Felipe was saying. And then back to what Bibiana was saying earlier, is it too late to speak up to the tech who started walking away? Like, honestly, I might have like chased after them and been like, get back here. I am not authorized to do this. Because I mean, it isn't essentially our problem. At the end of the day, I feel like it's the tech who left us. And the problem is if we are going to go through and do something that we're not allowed to do, if we don't do that, I think it's still kind of the tech's problem. Like if they left, they should know that. And then other techs in my hospital, they always talk about surgeons, and I feel like they kind of would know that we aren't authorized because they don't even want the student usually doing it. So I think if they saw them walk away, they would be like, get back here as well. But yeah, that's kind of what I have for viable solutions.
Awesome. Bibiana, do you have anything to add to it, or maybe something different? I know we said a lot already.
Yeah, I think it's the same. And I feel like, yeah, I guess if a tech gets paged, I think someone else will come back. Because imagine if the student wasn't there and they're paging that tech, then someone has to relieve that tech. So I feel the same as you guys were saying.
Yeah. Well, not my only thing, but like when we go into OR, we're usually second year students. So like I'm like not now, obviously not now, we wouldn't be left alone, but maybe as a second year student. Like even as a first year student, me and another student were left like alone to do a chest x-ray because we comped on it. You know what I mean? Like there was no, like nobody was kind of immediately available or right out the door, you know, we just did it. They just left us to do it. So I don't know, as a second year student, if they have that kind of confidence in them, maybe it would work. If I'm just pushing a button, you know, maybe it would work. It would be okay. You know, not forever, but you know. So with picking the best solution, I would just try all of our possible solutions before like actually doing it by myself. Like if it's a life or death situation and like I had to take direction and I had to do what I had to do, like I would do it. I wouldn't, you know what I mean? Like leave with the tech, but it is a problem that the tech left. I'd probably bring that up to somebody. Like awkward. I would try my best though. But
Like my first would be speak up to the tech before they go. Like if they get within 10 feet, I'd be like, where are you going? But if they're already gone, speak up to the surgeon. Like I'm unable to proceed with this procedure. Because I thought that fluoro, it has to be direct supervision at all times, no matter what student. So they have to be in the same room. It can't really be like the chest x-ray, I thought, where they just have to be on the same floor, kind of indirect to where they're immediately available. So for me, I would definitely speak up. It's my final answer for lock it in.
Yeah, because we want the best solution and the best outcome for the patient. So we want to get that done and not having the patient wait there till we like fix our problems with the techs.
Yeah. Felipe, you have the
Yeah.
best solution?
I'm there with Kaylin. I know that Professor Steele has told us, like, you know, you may not be someone's favorite, and you kind of have to speak up sometimes a little bit because you're going to be left in situations where you're like, one, not qualified, but two, you're like, hey, you kind of have to stand up for yourself, and yeah, we have to try to say this one's a tough one because like you have to try. I was like, hey, you can't leave. Like I'm not allowed to be here by myself. Like you're not just gonna throw it in their face and be like, what the hell? Like no, you can't. So he'd be like, hey, just wanted to make sure if you're gonna step out, there isn't someone else, to assist me as a student since I'm, still not comfortable doing this alone. And just kind of like say it like in a nice way, like, but so I agree with kind of like what Kaylin saying, what Brianna was saying earlier. It's like there's someone coming and kind of speak up. Might not be your favorite about it. Hopefully this doesn't put me in a weird light continuing in this wherever I'm doing my internship, but you have to say something.
Yeah, yeah,
I think also too, like Professor Steele was talking about in our last skills lab, like having to be an advocate for the patient's safety. At the end of the day, I think that's kind of like what the main thing or takeaway from the problem too is not putting the patient or the surgery, like compromising the surgery in any way. So I think speaking up, like you guys said, I agree.
yeah, definitely. Switch to anybody there, but like, I'm not qualified. I need somebody here. Nobody yell at me or anything. But yeah, those are all great solutions. I think definitely talking and telling the tech kind of our own protocols, because I think some of them don't even know our own protocols. In the beginning, nobody knew that first years aren't supposed to go to OR, and a couple of us did go. So it's just like those little things that they also don't know. So yeah. I think we're done. If there's any last minute comments or any more insight on the problem.
All right, we're all set.
All right, thanks guys.